Together all the national and international updates on the COVID-19 outbreak, steps taken by administration, inputs by our correspondents, global developments and experts' advice. All packed together in the next 30 minutes. Let's begin with the top updates at this hour. Centre and state step up efforts to provide succor to underprivileged sections during lockdown. Nationwide, more than 21,000 relief camps set up to house more than 6.5 lakh migrant workers, where they are being provided food and shelter. Centre issues ordinance for extension of various tax compliance deadlines in the wake of coronavirus crisis. Donation to PM Care Fund to be 100% tax-free. All investments up to June 30th to be considered savings in the current financial year. About 100 people who joined a religious congregation in Delhi found corona positive. 50 of them are from Tamil Nadu. Over 1,000 persons who attended the congregation sent for quarantine in Delhi. Delhi government files FIR against the organizers. Number of active corona positive cases in the country stand at 1,238, while the death toll goes up to 35. 123 persons have been discharged after recovery. Maximum single-day spike in corona positive cases numbers mostly mount in the worst affected states of Maharashtra and Kerala. Prime Minister Narendra Modi holds a telephonic conversation with French President Emmanuel Macron. Both leaders agree that the present crisis is a turning point in modern history, which provides a new human-centric concept of globalization. External Affairs Minister S. Jaishankar holds telephonic discussion with his US counterpart Mike Pompeo. Both leaders discussed joint strategy to combat the worsening coronavirus crisis. And as countries world over grapple with the coronavirus crisis, its intensity weakens in the worst hit Italy and Spain, while it intensifies in the United States of America as the death toll crosses 4,000. Donald Trump warns next 2 weeks are going to be very painful. Well, now for into detail updates on coronavirus nationally and globally. Union government has reiterated that strict action will be taken against landlords who threaten to throw out nurses, doctors or healthcare professionals. Joint Secretary of Home Affairs Punya Saila Srivastav said there is no shortage of essential commodities, while more than 6 lakh migrant workers have been provided shelter.
लॉकडाउन का एनफोर्समेंट स्टेट्स और यूटीज़ में संतोषजनक रूप से चल रहा है। एसेंशियल सप्लाईज की स्थिति भी संतोषजनक है। जो हमें राज्य सरकारों और यूटी से जानकारी प्राप्त हुई है, उसके अनुसार लगभग स्टेट्स और यूटीज़ में लगभग 21,064 माइग्रेंट रिलीफ कैंप्स सेटअप किए गए हैं और इन रिलीफ कैंप्स में लगभग 6 लाख से अधिक, अगर मैं एग्जैक्ट फिगर कोट करूं तो 6,66,291 लोगों को शेल्टर की सुविधा दी गई है। इसके अलावा लगभग 23 लाख लोगों को भोजन की भी सुविधा प्रदान की गई है।
The government on Tuesday brought in an ordinance, the Taxation and Other Laws Relaxation of Certain Provisions Ordinance 2020, to give relief in compliance in filing income tax, GST, customs and central excise returns to help taxpayers tide over the coronavirus crisis. The ordinance extends the date for linking Aadhaar PAN linking date to the 30th of June this year. The date for making various investments and payments such as Mediclaim donations, LIC, Public Provident Fund for claiming deductions has also been extended to June 30th this year. Hence, the payment can be made up to 30th of June for claiming the deductions under these sections for 2019-20. It also extends the date till June 30th for the passing of order or issuance of notices by the authorities under various direct taxes and Benami law. Further, a reduced rate of 9% interest shall be charged for non-payment of income tax. Besides, the date for Vivad Se Vishwas scheme has been extended by 3 months till June end. The ordinance also amends a provision in the Income Tax Act to allow 100% deduction on donations to the PM CARES Fund. Earlier, the limit on deductions was 10% of the gross income. The donation under PM CARES made up to 30th of June shall be eligible for deduction from income of 2019-20. Finance Minister Nirmala Sitharaman had on March 24th announced easing of various compliance and statutory requirements for filing tax returns as a relief to taxpayers fighting the COVID-19 pandemic. The government has slashed the interest on small savings schemes by up to 1.4% effective for the first quarter of the financial year. Interest rate on senior citizens deposit scheme also reduced from 8.6% to 7.4%. PPF will get 7.1% interest instead of 7.8%. Interest rate on Sukhanya Samriddhi Yojana has been reduced to 7.6%. Well, now coming to India and taking stock of the key developments in India vis-a-vis COVID-19 in Ground Zero. Well, government has maintained that it is committed to identify, isolate and quarantine COVID-19 positive Tabligh Jamaat workers in India. The Home Ministry released a statement on Tuesday over the Tabligh Jamaat issue, stating that on March 21st, the Ministry of Home Affairs was prompt to share details of the Tabligh Jamaat workers, which included foreign nationals in India, further stating that this information was shared after COVID-19 positive cases surfaced in Telangana.
निश्चित तौर से जैसी दिल्ली की खबर आई और तेलंगाना की खबर आई है मीडिया के द्वारा, ये चिंता बढ़ाने वाली बात है। दुनिया की तुलना में भारत में अभी इसके चलते इसके प्रसार में बहुत बड़ा नियंत्रण हुआ है। जनता महसूस कर रही है और जिम्मेवारी से लॉकडाउन का पालन कर रही है। इसमें ये जो मसला आया निजामुद्दीन का, ये बड़ा दुखद है, ऐसा नहीं होना चाहिए।
The ministry acted swiftly on March 21st itself, sharing details of foreign and Indian Tabligh Jamaat workers in India with all states. The swift action was taken with a view to identify, isolate and quarantine. Tabligh Jamaat workers might be COVID positive. Instructions were also issued by the Ministry of Home Affairs to Chief Secretaries and DGPs of all states as well as the Commissioner of Police in Delhi. The advisories were reiterated by the DIB to all state DGPs on March 28th and 29th. Meanwhile, workers staying in the Markaz in Nizamuddin were also screened. So far, 1,339 Tabligh Jamaat workers have been shifted to 3 quarantine facilities as well as to government hospitals in the capital as well as AIIMS Jajjar. Rest of them are currently being medically screened for COVID-19 infections. Delhi police has lodged an FIR against Maulana Saad and others for violating government directives. Tabligh Jamaat Markaz is located in Nizamuddin, Delhi. Devout Muslims from across the country and also from foreign countries visit the Markaz for religious purposes. Some also move out in groups to different parts of the country for Tabligh activities. On 21st of March, approximately 824 foreign Tabligh Jamaat workers were in different parts of the country for missionary work. Besides, around 216 foreign nationals were staying in the Markaz. In addition, over 1,500 Indian Tabligh Jamaat workers were also staying in the Markaz, while around 2,100 Indian Tabligh Jamaat workers were touring different parts of the country for missionary work. Well, for more on this story, Sudhakar Das, our correspondent, joins us on the phone line. So, Sudhakar, what's the latest there when it comes to this particular story, when it comes to, the Tabligh Jamaat workers who are now being shifted to various centers and being quarantined? Give us an update on what's happening when it comes to screening all of them that are now isolated.
जी बिल्कुल, देखिए अनिल, खास तौर पे अगर दिल्ली की बात की जाए तो दिल्ली में जो निजामुद्दीन में हेडक्वार्टर था इनका जमात का, उसको डीकंजेस्ट कर दिया गया। हमको जानकारी है कि कल तक जो सभी लोग थे, करीब 1350 लोग थे, उनको क्वारंटाइन कर दिया गया था। अलग अलग अस्पतालों में भी जरूरत के मुताबिक भर्ती कराया गया है।
ओके।
जहां तक सवाल जो स्टेट्स में गए थे, खास तौर से दिल्ली में कार्यक्रम में शामिल होने के बाद स्टेट्स के दौरे पर गए थे, तो उन लोगों की भी पहचान एक तरह से हो गई है, उनके बारे में भी जानकारी उपलब्ध है सरकार के पास। और 21 मार्च के अलावा 28 मार्च को भी जो पूरा लिस्ट है वो राज्य सरकारों के साथ शेयर किया गया था, और उसमें भी काफी एक्सटेंसिव काम हुआ है। राज्य सरकारों के मुताबिक उन तमाम जगहों पर पहुंचा गया है और उन कार्यकर्ताओं की भी पहचान की गई है, जिसमें से कुछ विदेशी कार्यकर्ता भी शामिल है। तो ये काफी महत्वपूर्ण है। लेकिन एक चुनौती है अनिल, ये खास तौर से पता करना कि ये जो लोग दिल्ली में जो लोग थे, और या फिर जो लोग देश के अलग अलग हिस्सों में राज्यों में गए, वो किन लोगों के कॉन्टैक्ट्स में आए, तो ये थोड़ा चुनौतीपूर्ण कार्य है। और जिन जिन इलाकों में गए थे, जहाँ पे ये रह रहे थे, जहाँ उनका विजिट हुआ था, वहाँ भी स्थानीय स्तर पर प्रशासन कोशिश कर रहा है स्थानीय लोगों को थोड़ा अवेयर करके इनके मार्फत जानकारी लेके कि कांटेक्ट में कौन लोग आए थे। तो ये एक थोड़ा चुनौतीपूर्ण कार्य है, लेकिन काफी कह सकते हैं बड़े स्तर पर काफी लोगों को इस काम में लगाया गया है, मॉनिटरिंग के लिए, ऐसे लोगों की पहचान के लिए, ऐसे लोगों को पता करने के लिए, ताकि उनको भी क्वारंटीन किया जा सके। तो एक तरह से इन तमाम लोगों ने, खासतौर से जो विदेशी है, इतनी बड़ी एक तरह से एक कार्यक्रम को ऑर्गेनाइज नहीं करना था उस तरह की स्थिति में, बावजूद उसके ये हुआ। जो विदेश से आए थे लोग टूरिस्ट वीजा पर, वो मिशनरी कार्य कर रहे थे, तो वीजा नियमों का उन्होंने उल्लंघन किया। उसको लेकर भी स्टेट्स को बोला गया है कि वो सख्ती से इस मामले में कार्रवाई करे। टूरिस्ट वीजा पर कोई मिशनरी कार्य नहीं कर सकते हैं, तो ऐसे लोगों की पहचान करके पुलिस कार्रवाई हो, एफआईआर दर्ज हो, इस तरह के भी निर्देश दिए गए हैं। तो निश्चित तौर पर एक चुनौतीपूर्ण कार्य है, लेकिन बड़े स्तर पर तमाम राज्यों के लोग केंद्र की मदद से लगे हुए हैं इस काम।
Sudhakar, purely looking at the magnitude of, finding out these people who are now in various parts of the country, how difficult, how surmount is this challenge, finding, tracking these people out, also isolating them and quarantining them?
देखिए, करीब 2000 लोग जो इस जमात के जो विदेश से हिंदुस्तान में आए हुए थे, और यहाँ वो मौजूद हैं 2000 लोग, और उसमें से 150 लोग वो हैं अनिल जो मलेशिया से आए। आपको जानकारी है कि मलेशिया में मार्च के पहले हफ्ते में कुआलालंपुर में इनका एक कार्यक्रम हुआ था, और उस कार्यक्रम में ये पब्लिक डोमेन में भी है कि कई लोग कोविड-19 से पॉजिटिव पाए गए थे। और ये इसके बाद खुफिया एजेंसियों ने, केंद्र ने राज्यों को सतर्क किया था, क्योंकि ये ऐसी आशंका है कि वहां से ये संक्रमण लेके यहाँ आए और दिल्ली से फिर जो है बाकी राज्यों में ये लोग पहुंचे हैं। तो निश्चित तौर पर एक चिंता का विषय जरूर है, एक चुनौतीपूर्ण कार्य जरूर है, लेकिन बड़े स्तर पर पूरी कोशिश की जा रही है। और एक तरह से ये लोगों के लिए भी एक सबक है कि इस तरह की किसी भी गतिविधि में ना लगे। ये हमारी, आपकी और हम सबकी सुरक्षा के लिए बहुत अहम प्रश्न है। और एक तरह से वॉलंटरी भी इन तमाम लोगों के जो लोग संपर्क में आए हैं, उनसे भी अपील की जा रही है कि वो आके बताएं, ताकि जो और व्यवस्थाएं हैं, क्वारंटीन या इस तरह की व्यवस्था है, वो की जा सके। अभी भी थोड़ा और अवेयरनेस की जरूरत है, क्योंकि कई लोग इन जानकारियों को छिपाने की कोशिश कर रहे हैं। ये उनके लिए, उनके परिवार के या फिर जो पूरी सोसाइटी के हित में नहीं है, तो लोगों को सामने भी आना चाहिए। ये एक तरह से अपील भी है तमाम राज्य सरकारों।
Okay, we'll leave it there. Thank you and appreciate you joining us with those inputs there on that story. Remember, it's you need to come forward and let the people know, let the officials know about your travel history, so that you can be isolated and you can be quarantined. It not only benefits you, but it also benefits the society at large. Moving ahead, as the nation enters the 7th day of lockdown, the active cases of COVID-19 has reached 1,238. Out of which 123 people have been cured of the disease, while 35 have succumbed to the COVID-19 infection. Ministry of Health is working in close coordination with states in tracking the contacts of the coronavirus in the country. A high-level meeting of the group of ministers on COVID-19 was chaired by Union Health Minister Dr. Harshvardhan in Delhi. Minister of External Affairs Dr. S. Jaishankar, Minister for Civil Aviation Hardeep Singh Puri, Minister of State for Home Nityanand Rai, Minister of State for Shipping Mansukh Mandavia, besides other ministers and officials were present at the meeting. The group of ministers reviewed the current status, actions and preparedness of states as well as union territories for the management of COVID-19. The GOM also discussed the need for each state to set up exclusive hospitals for COVID-19 patients. A Science and Technology Empowered Committee for COVID-19 response has been constituted, chaired by Professor Vinod Paul, member of Niti Aayog and also the principal scientific advisor to the Government of India, to coordinate among science agencies, scientists, industries and regulatory bodies. The committee will work with the Department of Science and Technology, Department of Biotechnology, Council of Scientific and Industrial Research, Defense Research and Development Organization and the Indian Institute for Science to take speedy discussions on research and development, keeping in view the critical need to increase the testing facilities for COVID-19 disease. The empowered group of officers, 10 constituted under the Disaster Management Act of 2005 on public grievances and suggestions to ensure timely implementation of COVID-19 response activities, met on Tuesday and took the decisions to identify the problem areas and to delineate policy, formulate plans and strategize operations and take necessary steps for time-bound implementation of decisions. The meeting was attended by Amit Khare, Secretary HRD, Dr. Shivaji, the Secretary of DARPG, Ashutosh Agnihotri, Joint Secretary MHA, Meera Mohanty, Director Cabinet Secretariat and other senior officials from the PMO. As the coronavirus lockdown has left many without jobs or money to buy food, Delhi government decided to triple the scale of the ongoing food distribution program meant to feed the poor people in the national capital during the 21-day nationwide lockdown imposed to prevent the spread of COVID-19 disease. While the government was lauded for its efforts, reports have emerged that no effort was being made to maintain social distancing and necessary precaution to curtail the spread of the virus that has claimed thousands of lives across countries. Our correspondent Tapas Bhattacharya decided to take stock of the situation and spoke to the Assistant Section Officer Ravi Chandran, who has been working tirelessly to provide relief material.
Lockdown is in full force in the national capital, and to provide relief effort, I've joined with me people who are working along with the civil defense personnel to provide food and shelter.
We have been getting food from the centralized kitchen. Every day, 3 times food is coming, transported by Tata 407, and we have got around 200 people here staying. So we are convincing people to come in and stay so that they are not stuck in between.
This is actually the last border area from from here the UP border starts. So the work of these people along with the civil defense personnel is to make sure that they have been taken taken care of, and they are been put in this Ran Basera.
Ready with 2,000 to 2,500 people.
Okay.
At this moment, I am having around 250 people. So I am ready with for another 1,750 or 2,000 people. I am ready to cope up.
So that's the whole idea. These people are leaving no stone unturned to make sure that this fight against this coronavirus in the lockdown be a successful one, and they are what you call the unsung heroes of India. This is Tapas Bhattacharya, DD News, Delhi.
Well, for more on this story, let's head to the western part of India, to Mumbai, where Shishir, correspondent joining us from Mumbai. Maharashtra, remember, has the highest number of positive cases for COVID-19, joining us this morning. Also, we've got Philip joining us from Chennai there. So, 2 people joining us, one from Chennai, the other joining us from Mumbai. But coming to you first, Shishir. Shishir, give us a sense of overnight. We've seen the numbers. Is there an escalation in numbers there in the state of Maharashtra? And what are the challenges before the state government and also the Mumbai police and all other police department, especially when it comes to managing the people there, asking the people to stay indoors?
Well, absolutely. At this point in time, you rightly said the numbers has increased. The number reached to 320. Earlier, the number was 302. And yesterday, by this time around, the number was around 213 only. But later on, there was a spike in the numbers because we've also spoke to authorities and they've said that the Maharashtra government has given permission to some of the private labs and the results were awaited. Yesterday, the Maharashtra government received results from those private labs, and that's the reason the number has increased. Those number wasn't increased in a day. It was accumulated numbers since last 2 and 3 days, as these labs were actually conducting the test since last 3-4 days. And that's the reason yesterday when those reports were approved by the government, the numbers are immediately increased. And currently in Maharashtra, 300 as the number is, the government is taking ample steps here. The most important thing is to increase the labs facility here. And currently in Maharashtra, 23 labs are operational, out of which 10 labs run by the government agencies, and the rest of the 13 labs have been run by the private agencies. That's what the information given by the authority here. But the positive news at this point in time is that nearly 39 patients have been discharged. They have been found negative. Earlier, there were actually these 39 people were found corona positive, but later on when they had a swab test, it has been found that these patients are now found negative, and that's the reason they have been discharged, have been told to be at home quarantine here. Well, apart from that, the preventive measures and control the preparedness of coronavirus, the isolation wards have also been created in district hospitals and the primary care also at various locations in the village area as well. So that's the reason to penetrate in the grassroots level, the government is actually taking various steps here, be it at district level hospital, also primary and tertiary healthcare also, then spreading the entire health kit and the health department also. So government is not just focusing on the urban areas, but the rural areas as well, because some of the numbers that we have seen, the spike is not just in Pune and Mumbai, but some other parts of Maharashtra, which is a remote area of Maharashtra, and that's the reason government is focusing on those areas. Now, the next important part is supplies of the food and food grains here. The government is actually taking various measures here, and that's the reason they have started decongesting the vegetable markets. Earlier, the APMC used to see a lot of crowd there. People used to come there for shopping for the vegetables since last couple of days here. But now the government have reduced the numbers of the trucks which comes to APMC, and have also told the retail market, the retail vegetable markets, to also decongest themselves and also to organize an open market. And open ground as well.
Steps being taken by the state government there to decongest the market, also to help the people find the ways on getting their basic essential needs. Well, shifting focus now to Chennai down south, where Philip Thomas joins us on the phone line. Philip, good morning. Philip, the same question that I asked Shishir, there's been a spike in numbers in Maharashtra. What's the news that you get for us from down south? Is there a spike in numbers or do they remain constant?
Well, absolutely. Anil, there has been a spike in numbers. In fact, yesterday was the day in which Tamil Nadu saw the highest one-day spike. In fact, over 50 cases were reported yesterday. Most of them, of course, linked to that religious conference that was held in New Delhi, where over 1,500 people from Tamil Nadu are supposed to have attended. And the health officials say that close to 1,100 of these people have returned to Tamil Nadu, but they have been able to trace just about 515 of them, so which leaves about 600 people still untraced, and most of them, their contact numbers are also switched off. So the state officials are clearly worried, because this is something that could lead to what's known as cluster transmission. In other words, they could infect not only their family and friends and relatives, but people in the areas in which they live. So this is something that the state government is worried about. And these are for example, in districts like Erode, where some of these people hail from, the authorities are going about sanitizing these areas. Many of these areas are being quarantined separately, so to ensure that the disease does not spread. So there's a great deal of focus on ensuring that many of these people can be tracked down, and the disease can be arrested before it becomes a statewide threat.
We'll leave it there, Philip. Thank you and appreciate you joining us. You take good care of yourself. We'll come back to you for more updates on that particular story as we track down those people, especially as Philip mentioned, those from Delhi who were there in Nizamuddin Markaz, who have now 600 of them still not been able to trace, but the state authorities and the police there going all out in trying to find them and isolate them, along with that quarantine them. Moving ahead, Prime Minister Narendra Modi on Tuesday spoke to the French President Emmanuel Macron. Prime Minister expressed his condolences to President Macron for the loss of lives in the ongoing COVID-19 pandemic. The leaders discussed domestic and international aspects of the crisis and underlined the importance of global collaboration and solidarity in the present situation. They agreed that the expert teams of both countries would actively share information on measures to prevent the spread of the virus and research on treatment and vaccines. President Macron strongly agreed with Prime Minister's view that the COVID-19 crisis is a turning point in modern history and offers the world an opportunity to forge a new human-centric concept of globalization. They also stressed the need to devote special attention to the needs of less developed countries, including those in Africa, during the present crisis. President Macron warmly welcomed Prime Minister's suggestion that the practice of yoga offers a convenient means of ensuring mental and physical well-being for people confined to their homes by the pandemic. Well, that's all we have time for in this edition of Tracking COVID. Remember, the 21-day lockdown is still on. You got to stay indoors and stay safe. It's your safety and the safety of the society at large. That's all from me. Thanks for watching. Bye-bye.